It's been 5 years since the VA hospital in Phoenix made national headlines when reports surfaced saying workers were falsifying records to make it look like veterans were treated quickly, when in fact, some waited months for care. So what's happened to wait times at the VA since then? Cronkite News reporter Julian is live in our Washington bureau with the details.
Today's hearing before the House Veterans Affairs Committee had none of the fireworks of hearings 5 years ago, when the Phoenix VA wait time scandal first broke. That's because VA officials and lawmakers agreed that things, for the most part, are getting better.
We have a lot of work to do still, but we are on a great trajectory, as our veterans have been telling us that they are more than 77% of them are satisfied and they trust us.
Boyd said wait times for many VA services now rival or beat those of private practices. Critical referrals to a specialist that used to take almost 20 days now take 1.4 days, she said, well within the target of 48 hours. Boyd wasn't the only one praising the VA's progress. One senior committee member said the numbers of what the VA has been able to accomplish speaks for themselves.
Last year alone, VA completed more than 1 million more appointments than it had the year before. In many cases, those appointments occurred faster within VA than they would have in the private sector, according to the Journal of the American Medical Association.
But some lawmakers are still skeptical of the numbers.
Why don't you measure wait times from the time the veteran asks for an appointment and the time he or she receives an appointment? That's the only answer I want. Why is it that you don't measure it that way?
An expert from the Government Accountability Office said the problem of wait times has dogged the VA for years. While the agency has clearly made progress, she said, it is an ongoing struggle.
We still are concerned about the reliability of the wait time measures. And I think getting back to the scheduler training, this is something that needs to be ongoing and persistent. It's not a one-time and done.
But witnesses from the VA said they have done the job they are sworn to do, serve their veteran communities in a timely fashion. And they are confident the improvements will continue as they move forward.
We have a trajectory, we have a sense of urgency, we have improvements in our scheduling packages as well as our community care networks.
While things are better, they're not perfect. One lawmaker told of a vet who needed urgent mental health care but was turned away from 2 separate VA clinics. We reached out to veterans groups in Arizona to get their take on how well the VA is doing, but have not heard back. In Washington, Julian, Cronkite News.